Good afternoon, everyone. Wynn Brown here with Haywood Healthcare's COVID-19 update for the week ending Friday, July 17th. I hope everybody's doing well. Looks like we have a great weekend up ahead. And so as I always encourage everyone to get outside and enjoy the outdoor environment around north central Massachusetts and the Quabbin region so that we stay healthy and well and get to enjoy the summer, which we always know is far too short. So please take advantage of that. Let's just go right to our testing like we always do right out of the bat. So far, Haywood has tested 10,590 specimens or patients with 9,554 negative results, 519 positive, 89 indeterminate. That puts our 7-day rolling average at 0.41% and the state at 1.7% positive rate. Cumulatively, we are at 5.1% versus the state at 8.8%, so we continue to beat the state and doing a very good job, and that has to do with hand hygiene and social distancing and wearing masks and doing all the right things to make and getting tested when appropriate or when you want to get tested to make sure that we are on top of our game, and we've done a good job so far, especially as you look to the southern tier of our states where it is an incredible heavy caseload and continuing spikes of COVID-19, and we just don't want that to happen in our region again. And so I appreciate everybody's good work on that. Statewide, 1,274,000 patients have been tested, which equates just down to under 1 million individuals have been tested. Because remember, once you get tested and you're positive, you end up being tested multiple times. Also, there was a question on our data when you add up all the data I give you on testing, it doesn't come out perfectly, and that part of the reason is that we don't have test results back yet. And so that's why if you're a math wonk, why the math doesn't work out perfectly, it's because tests have not returned yet, and so they're not in the total. Good news at Haywood Hospital today is that we have no COVID positive inpatients or suspect patients. So we have not seen a lot of that. It's usually been 1, 2, or 3 patients in-house and a couple of rule-outs, but it's a great day at Haywood, and that just goes to the great work our community's doing and our teams are doing across the region. In Worcester County, there have been 12,738 cases with 968 deaths, and Franklin County just ticking up to 386 with 58 total deaths. So those are the numbers across the region. Embedded with this email is the city by city or town by town rates, testing and rates. And so you can take a look at that at your leisure and see the towns in our service area and what our testing rates look like by town. Also, as some of you know, certain states, including my home state of Maine, requires those coming to stay in Maine, 1 to quarantine and 2 to arrive with testing information. And so we have a link on this email where you can find out what different states require and make sure that you understand that if you're going to be traveling out of state. Also, we have our drive-through testing on the Haywood campus and also testing at Tully walk-in care in Athol. You can call and make an appointment. The number is in here as well. Typically, we can get you that appointment within a day, and it really takes, as I've told you, I've done it, takes 3 to 5 minutes and you're on your way. We are now doing COVID-19 testing in-house. We have the reagents. We've always had the equipment, but being a smaller health system, we were slow to get supplied by our vendors, and we now have that. And so our turnaround time is somewhere in the 36-hour range, so much better than the other places, especially the reference labs that are getting huge volume from the south and slowing down that. So a very big shout out to our lab team who has put that all together, and we're incredibly appreciative of the hard work they're doing. And all this testing is being run at third shift, and so that's an incredible additional workload put on our third shift lab team on the Haywood campus, and we appreciate the great work you're doing to help support our community. Good news on Monday, the south entrance at Haywood Hospital will open, so we will go to 2 entrances, and they will be manned entrances, and you will be screened. And so staff, of course, can fast track through because they're self-attesting, and visitors will get screened, and you have to don a mask when you enter the facility and wear it throughout your stay. If you are going to a surgical day in the emergency department, you have to wear a surgical mask versus a homemade mask, and so you'll be given that if you don't have one with you. We have actually been, believe it or not, been getting pushback from our community members in some instances that they don't want to wear a mask or they want to take the mask off for their procedure. That is not allowed. So no mask, no service unless you're coming in for an emergency. We have zero tolerance for that. And so when you're coming in for an elective service, that's what it is. It's elective. You don't have a right to it, but we are happy to provide it. And so if you're going to come into our facilities, you need to follow our rules. So please be gracious and thoughtful, because you are protecting yourself, protecting our staff, and we really need to make sure we're doing that. If you are an inpatient, you are allowed one visitor at a time, and so they will be screened and when they arrive, we will call up to the floor. And if there are multiple family members who want to visit, they have to come in and go out only one at a time, as we limit those things. So please be understanding of that. Again, we've been getting some pushback at the front door, and a number of our screeners are young college kids who are home on break, and it's really not fair to put them in that situation if you are a community member. So please, I know I'm going into my lecture mode, but we need our hospitals and our staff to be safe and well for everyone, and so we need you to follow those rules. So please do that. Also, if you're going to an outpatient service, you can bring someone with you as well. They will be screened and they need to wear a mask. I did mention that the south entrance is opening, which is fantastic, but some of our staff who have been parking there in patient parking, because it hasn't been patient parking on Monday morning, you need to park only in staff parking so that our patients and our visitors can have access to our facility. So a reminder to the Haywood staff. Also, our Haywood Strong and Athol Strong swag has arrived, and so at Athol Hospital on Tuesday, the 21st, orders will be handed out in individual departments. And at Haywood Hospital in the Pierce boardroom on Wednesday, the 22nd, 10 to 1, Thursday, the 23rd, 1 to 4, and Friday, the 24th, anything that wasn't picked up will be delivered to make sure we get that swag to you. The orders have been fantastic. I love wearing my Haywood hat, as you know, all around town, showing how proud I am of our organization and the great work that we're doing. As you know, our golf tournament is coming, the Watkins Faust Open. It's more of a virtual format this year. We have new sponsors. Advanced Cable Ties is a fairway sponsor. Hudula Oil and Propane is a tee and team sponsor. Dr. Dan Esquino, who is the president emeritus at the Mount, became a tee and ad book sponsor as well. And so those sponsorship opportunities close up on Monday, and they go to our COVID-19 relief fund. So if that's something you want to do, please reach out to haywood.org/Haywood Golf, and we'll get you signed up. Our Ride for Our Life is our other big summer fundraiser, our motorcycle ride, and it is now a virtual event, and it's noted that it's a wind therapy challenge this year. It will begin on August 1st and run through September 8th, and there's a link that you can click on and participate in that. And in closing, this video, we're doing it once a week. If there's something you want me to address, I'm happy to talk about just about anything on this video. And you just need to email communityrelations@haywood.org, and we'll do our best to answer any questions you have or share information that you think is important. So I hope you all have a wonderful weekend. Thank you for the incredible work the staff is doing and the community is doing as we continue our journey to be one of the best community-owned health systems in America. Take care, everyone.